Well, hi, everybody. I want to welcome you to a webinar that we are very excited to present to you. I'm Alan Hollander. I'm the CEO and founder of ePractice Manager. What we do is we provide business-related training and systems to practices. So doctors can focus on treatment and not be burdened or overcome or distracted by management, by the business side of things in a practice. And there are many of those. And as part of this, we often do training and education on the importance of dentists and anyone who is presenting treatment to patients to get across to them the consequences of opting out of dental treatment. The serious systemic problems that can result from poor or incomplete dental care are very, very well documented. And we talk about this a lot in terms of presenting treatment to patients because it's so important for them to understand this. But when I became familiar with Dr. Bryan and his research, and I could clearly see further the scientific evidence of neglected dental care and its relationship to serious disease, cardiovascular diabetes, there's evidence of Alzheimer's and a host of other widespread health problems. When I saw that, I knew that it was important to ask Dr. Bryan to share this, a bit of what he has done with our clients and dentists as broadly as possible. So I'm delighted that he's agreed to do this, and I really want to thank him very much. He's got a very impressive bio and much too long to list, but his doctorate is from Louisiana State School of Medicine. He was a fellow at Boston University School of Medicine at the Whitaker Cardiovascular Institute. After 2 years there, he was recruited by the Nobel laureate, Dr. Fareed Murad at the University of Texas Health Science Center, where he continued to make really what are considered seminal discoveries. And during his tenure there as faculty and independent investigator at UT, his research focused on drug discovery through screening natural product libraries for active compounds. And his discoveries and his patents are some of the most successful in the history of the University of Texas system. So it's with a great pleasure and appreciation that I want to introduce you to Dr. Nathan S. Bryan. So over to you, Dr. Bryan.
So what I thought we would do was, assuming I'm speaking to a lot of dental professionals or dentists or really healthcare practitioners all around, maybe even some patients. And so I've tried to organize these slides to give you some new information. But what we've learned over the past 20 years is really the mechanism of action for an oral systemic link. So it's been known for many years that people with poor oral hygiene, gingivitis, periodontal disease, have a much greater incidence and risk of having a heart attack or stroke and really all-cause mortality. But in this interesting time of COVID, I thought maybe the most important slide I could talk about is this slide here. And I'll give you the evidence for this in the next half hour. But nitric oxide deficiency causes chronic disease and increases sickness and mortality from viral infection, including coronavirus infection. So if there's one thing that I hope to convince you tonight, the most important thing you can do for your own health is to improve your body's ability to make nitric oxide. So I'm going to tell you things that you may be doing and you may be recommending to your patients as dentists that may be unintentionally disrupting nitric oxide production and putting your patients at additional risk for not just cardiovascular disease, but for increased infection and rapid progression of the coronavirus. And as Alan mentioned, I've been doing this for over 20 years now, and really my research program has tried to answer 4 very important questions. Number 1, how does the human body produce nitric oxide? What goes wrong in patients that can't make it? What are the clinical consequences? And then perhaps most importantly, how do you fix or restore endogenous NO production? In this 20 years of research, I have dozens of issued U.S. and international patents, published hundreds of papers in the peer-reviewed literature, and given over 200 lectures worldwide. I'm required to share with you my conflicts of interest. Obviously, when you have discoveries that have commercial value, you develop conflicts of interest. So these are my companies that I've either started or licensed my patents from the University of Texas, and then I receive royalties on these patents from the University of Texas Health Science Center in Houston. But my guiding principle, ever since I got involved in basic science, was to see what everyone else has seen, but to think what no one else has thought. And that's quite challenging today in the scientific literature, because there were over 170,000 scientific papers published on nitric oxide. And so I like to start from the basics. So no matter what disease you may have, whether it's Alzheimer's, Parkinson's, diabetes, heart disease, erectile dysfunction, it's all characterized by one common denominator, and that's reduced blood flow. So in these particular imaging modalities, this is a SPECT scan. Some of you may be familiar with Daniel Amen, but you can get a picture of the brain, or really any organ for that matter. And what you're looking for is a nice a lot of conformity around the brain, and that tells us that there's sufficient and symmetrical blood flow to all regions of the brain. And if you take a patient, an unhealthy patient, in this particular case on the right, this is a patient with an addictive disorder. And you can see there's holes where there's reduced blood flow to the brain. And you can map this. It's the same in bipolar schizophrenia, Parkinson's, Alzheimer's, vascular dementia, any neurological disease. There's disruptions in the regulation of blood flow to certain regions of the brain. It's just like in heart disease. There's a disruption in the blood flow feeding the coronary arteries. So every single chronic disease is characterized by decreased blood flow to the affected organ. And it's also known that if you can restore blood flow and perfusion to these specific tissues and organs, you can correct many of these chronic pathological conditions. So the fundamental question that we asked years ago was, how do you restore blood flow and perfusion to these tissues? Because that seemed to be the holy grail in treating a lot of chronic diseases that the standard of care doesn't manage very well today. And you do this through nitric oxide, and that's what I'll spend the rest of the lecture on. I was trying to give you at least a conversational understanding and knowledge of nitric oxide. And this was the front page of the Wall Street Journal the day the Nobel Prize was awarded for the discovery of nitric oxide. And Val Pfister was quoted as saying that the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. And at that time, we thought nitric oxide was simply a vasodilator, meaning that it opened up the blood vessels and increased blood flow and oxygen delivery. But this paper from Jonathan Stamler several years ago revealed that nitric oxide is actually what controls oxygen delivery to every cell in the body. And without nitric oxide bound to hemoglobin, the oxygen will not come off. So even if you're giving patients 100% oxygen, you can get their O2 sats up to 98 or 99, but systemically they're hypoxic because the oxygen will not come off without the nitric oxide functionality. So in order to cure these chronic hypoxic conditions, you have to restore the production and functionality of nitric oxide. And we now know it's involved in every biological system, from not just maintaining the integrity of the cardiovascular system, but it's the molecule that tells our stem cells to mobilize and differentiate. It's a neurotransmitter in the central nervous system. It controls cell cycle, proliferation, very important in cancer. It controls blood flow in the urogenital tract. It's the molecule responsible for erections in both men and women. And it's also how our immune system fights off invading pathogens, such as viruses and bacteria. So if you become deficient in nitric oxide, you can then imagine the host of really multi-systemic disease that may occur from the single loss of nitric oxide. And these were the three gentlemen who shared the Nobel Prize in 1998. It was Fred Murad that in 1977 discovered that drugs like nitroglycerin work because they're metabolized into nitric oxide. And then in 1980, Bob Furchgott discovered that our endothelial cells, the cells that line all blood vessels throughout the body, releases a substance that causes these blood vessels to relax and dilate. And he called this molecule endothelium-derived relaxing factor, or EDRF. And then 7 years later, in 1987, Lou Ignarro discovered that EDRF is nitric oxide. And as you mentioned, Alan, it was Fred Murad recruited me to my first faculty position at the University of Texas. And Lou's written a foreword to several of my textbooks. So as a practitioner, even as a patient, you may ask yourself, do I need nitric oxide, or do my patients need nitric oxide? And so really anybody who's aging and getting older becomes deficient in nitric oxide, and I'll show you the data on that. But anybody with circulatory issues, diabetics, people with low energy, there's a clear mechanism of nitric oxide regulating cellular energy production at the level of the mitochondria. People with sexual dysfunction, and people on antacids. You need stomach acid to make nitric oxide. And I think from my perspective, the biggest impact we can have on public health is to get people before they start developing disease or symptoms. And if we can improve nitric oxide production, we can prevent a lot of these diseases, because prevention is much easier and cheaper than treatment. But if you go back to the basics, that a man is as old as his arteries, we begin to look at this intravascularly. So we know that the older we get, the less nitric oxide we make, and it's this loss of nitric oxide, this functional loss of nitric oxide precedes the structural changes by many years, sometimes decades. And so it's the loss of nitric oxide that really sets the stage for the deposition of fat, plaque, stiffening in our arteries, inflammation, oxidative stress, and immune dysfunction that occurs in cardiovascular disease. And in fact, when your body can't make any nitric oxide at all, and inflammation runs rampant, then this plaque becomes unstable, it ruptures, and that's a heart attack or stroke, depending on where that blood clot occurs. But it's also known that if you can prevent the early inflammation in the lining of the blood vessel, you can prevent cardiovascular disease. And the earliest step in this process is when monocytes and T cells and neutrophils begin to stick to the lining of the blood vessel. So the lining of the blood vessel gets almost like Velcro, where everything sticks. But what you want is an endothelium that's almost like Teflon, that nothing sticks, but it regulates what comes in and out of the vascular compartment. And so what we did is we could give an inflammatory diet and in real-time intravitreal microscopy look at monocytes and neutrophils that are sticking to the lining of the blood vessel. And so this is 6 weeks of an inflammatory atherogenic diet. You can see there's a little bit of blood flow getting through this arterial bed, but the little traffic jam here, if you will. And then a number of cells have migrated through. But if we take that same atherogenic diet and we restore the production of nitric oxide in this particular vascular bed, you can see the blood vessels more dilated, the monocytes and neutrophils home along the endothelium looking for sites of injury, but they don't stick and they don't migrate through. So this tells us that by simply restoring nitric oxide production, you can inhibit the earliest events in the onset and progression of cardiovascular disease, which is microvascular inflammation. And this, unfortunately, is what happens. The older we get, the less nitric oxide we make. And this is average data from 4 independent studies. So by the time we're 40 years old, we only have about 50% of the nitric oxide we had when we were younger. And so I don't think it's coincidental that this is the age that people start to feel the effects of aging. 50% of the men over the age of 40 self-report some degree of erectile dysfunction. I think the numbers are much higher because most men don't like to admit or self-report, certainly, that they have ED. And then, the older you get, the less you perform, not only in the bedroom, but the boardroom and even on the athletic field. So all that can be explained by this loss of nitric oxide production. So what are the clinical consequences? If you lose the main vasodilatory molecule nitric oxide, you develop high blood pressure. 2 out of 3 Americans, or over 200 million Americans, suffer from an unsafe increase in blood pressure. Erectile dysfunction, vascular dementia, and Alzheimer's, diabetes, peripheral artery disease, small vessel disease, atherosclerosis, blood clotting disorders, acute respiratory distress syndrome, heart failure, kidney injury, and immune dysfunction. And you may recognize that these are the exact patients that become at increased risk of COVID infection. And these are also the patients that once you get a positive coronavirus diagnosis, you rapidly progress to hospitalization, intubation, ventilation, and these patients do very poorly, and in fact have about a 10-time higher mortality if you have one or more of these underlying conditions. If again we go back to basic vascular biology, this is from a first-year medical student book in the pathology book, that it's recognized that well-vascularized tissues are more resistant to infections and capable of localizing and containing offending agents. And by contrast, poor vascularized tissue are inefficient in eliciting a robust immune response to kill a bacteria, virus, or fungal infection, whatever it may be. And this is a slide I put together almost probably 5 months ago in March when this coronavirus pandemic first started. But early on, it was known that if you had an underlying cardiovascular condition, your risk of death was about 10 times higher than those with no underlying cardiovascular condition. 15 years ago, this paper was published showing that nitric oxide can actually inhibit the coronavirus replication. And that's how our immune system works. We're all exposed to viruses and bacteria every day, but our immune system recognizes it, makes nitric oxide, inhibits the viral particle replication, and most people don't get sick from it. But if your body can't make nitric oxide, the virus takes hold, it rapidly replicates, it spreads throughout the body, and that's the multisystemic disease you're seeing today in many of these patients. The other thing we've recognized is the health disparities of coronavirus infection. African Americans are, it's killing more Black Americans in a disparate way than the age-matched, similar other ethnic groups. But it's also known from years ago that African Americans make less nitric oxide. And this is both partly a genetic and a lifestyle issue that basically renders them more compromised in their ability to make nitric oxide. So nitric oxide production explains the health disparities of African Americans, explains the increased susceptibility and risk of infection from coronavirus, and then a lot of the medications that are given for treatment of hypertension, ACE inhibitors and ARBs, actually increase the susceptibility to coronavirus. And so this was a joint statement from the ACC, AHA, and Heart Failure Society, showing that if you get a patient on ACE inhibitors, you may want to consider, or ARB is another class of antihypertensive medication, especially during this time. So let me just reiterate this because I think it's a profound statement that nitric oxide deficiency causes cardiovascular disease, increases sickness and mortality from viral infection. So again, the most important thing you can do is improve your body's ability to make nitric oxide. And now I'll take you a little bit through some biochemistry and really some practical applications on how you do this. So years ago, we thought that can we use nutrition, supplements, or food to enhance nitric oxide production? And most of you are probably aware of the atmospheric nitrogen cycle, that the air we breathe is 78% nitrogen. And then when lightning strikes, it actually, this high energy fixes nitrogen. So it breaks that triple bond and forms ammonia or nitrite or nitrate. And then any plants that are grown in the soil, then we eat those plants, we're getting a source of nitrite, nitrate, and to some extent, some ammonia. Or if we eat any animals that are eating the grass or the vegetables, then we now have exposure to nitrate, nitrite, and some of these nitrogen oxides. And about 15 or 20 years ago, it was realized that we have a human nitrogen cycle. So when we take in inorganic nitrate, for example, from green leafy vegetables like this spinach salad here, it was recognized that about 90 minutes later, this nitrate is concentrated in our salivary glands. And at the time, and this was discovered back in 1978, and people didn't know why the body would intentionally reabsorb inorganic nitrate, concentrated in our salivary glands, and then excrete it in our saliva. But today we know that there are oral nitrate-reducing bacteria that live in the crypts of the tongue that reduce nitrate to nitrite. And so if you don't have the oral bacteria, then this pathway becomes disrupted. And then when you swallow your saliva, which is then enriched in nitrite, when this enters the acid environment of the stomach, the pKa of nitrite is 3.4. So as long as there's stomach acid production, nitrite becomes protonated. This generates nitric oxide gas. And so eating a plant-based vegetarian diet and having sufficient stomach acid and the right oral bacteria has been shown to increase gastric mucosal blood flow, kill H. pylori infections that cause ulcers, inhibit ulcerations from chronic NSAID use. So this is a fundamental physiological pathway that becomes disruptive if you're using mouthwash, which 200 million Americans wake up every morning and use mouthwash, and another 200 million Americans use antacids. So when you use either of those, especially both in combination, you completely become nitric oxide deficient. I'll take you through the mechanism of that. And this is an age-old philosophy, let food be thy medicine, medicine be thy food. So we did a simple study, just really a literature search to see how much nitrate do we need, how much celery would one need to eat, or how much spinach or broccoli or kale. And the literature told us that you need about 300 to 400 milligrams of nitrate to see any change in blood pressure or improvement in exercise capacity. But the standard American diet, or the so-called SAD diet, we're only getting about 150 milligrams per day. So just as Americans are deficient in things like magnesium and selenium and chromium and iodine, we're basically a nitrate deficient population. And we quantified certain diets. So the Japanese diet, probably the most health and life prolonging diet there is, you can see the daily nitrate intake. And then the DASH diet, the dietary approaches to stop hypertension, works because in some people they can reduce the nitrate to nitric oxide and lower their blood pressure. But if we wanted to really, and this was a kind of a grand goal of ours, we want to change dietary guidelines. We could change how much celery would you need to eat, or how many servings of broccoli to get enough nitrate to manage your blood pressure. And so we published this in, I think, 2014. This is a busy slide. You may or may not understand it, but just suffice it to say that we went to 5 cities across the U.S., Chicago, Dallas, Los Angeles, New York, and Raleigh. And we got vegetables from Whole Foods, and we took them back to the lab and just measured the nitrate content. And what we found was quite shocking. So let's just take celery, for example. So if you lived in Dallas or Los Angeles, you could eat about 6 stalks of celery and get enough nitrate to normalize your blood pressure. But if you bought the celery in New York, you'd have to eat about 50 or 60 stalks of celery. And so this occurs across different vegetable categories. It occurs across different geographical locations. And this told us there's no way we can make dietary recommendations because it depends on where you live and what vegetables you may consume. To further complicate the matter, and I don't show the slide, but these are conventionally grown vegetables. We took organically grown vegetables, quantified them, and they have about 10 times less nitrate across the board. So organic is good in the fact that you're not getting exposed to pesticides or herbicides, but I don't think there's no way you can ever eat enough organic vegetables to get enough nitrogen in form of nitrate to manage your blood pressure. So no wonder 200 million Americans have an elevation in blood pressure. The other problem is most people eat, or try to eat healthy at least, and try to consume enough green leafy vegetables. The problem is that nitrate is inert in humans. We rely 100% on oral bacteria. And I think this is where dentists, in my opinion, are probably the most important healthcare practitioners on the face of the earth, because you guys control everything that goes into the GI tract. Starts in the oral cavity. And if you get rid of the pathogenic gingival bacteria that are causing caries and plaque, then you can improve the microbiome and the diversity in the oral cavity. However, if you get patients that are using mouthwash, chlorhexidine, even fluoride rinses, which is an antiseptic, you kill the bad bacteria, but the collateral damage is killing the good bacteria as well. And so that becomes evident here, because if you take normotensive patients, and this is a paper published in 2013, and you give them mouthwash twice a day for 7 days, their blood pressure goes up. Nothing else changes. Their diet doesn't change, their exercise regimen doesn't change, their medication doesn't change. Just simply applying mouthwash causes an increase in blood pressure. And this made sense to us because the microbiome that live in and on our body provide 3 million gene products. And the human genome is only about 23,000 genes. So the bacteria that live in and on our body do things that we as humans can't do or have yet evolved to do. And so killing these bacteria, infectious pathogenic bacteria, I agree, you need to get rid of them. But we have to be a little bit aware of the good commensal bacteria that are in our body and on our body to do certain things. And so I'll take you through a couple of really cool studies that we did at the time. And so we got an IRB to do tongue scrapings of people walking around the Texas Medical Center, and just to see what they had growing in their mouth, and could we culture any bacteria that were these nitrate reducers or nitrite reducers, and did this have any bearing on their blood pressure? And we published this in 2014, and what we found was that the diversity in the communities of bacteria they had growing on the dorsal part of their tongue were much different in people that had normal blood pressure and much different than those who had no ability to reduce nitrate and had the highest blood pressure. And so that was an interesting kind of an association between certain communities of bacteria and steady state blood pressure. But then we dug a little deeper and did a more controlled study where we took young, healthy, mainly dental school, medical school students, some dental medical school faculty, and we gave them the daily tongue scrapings, chlorhexidine mouthwash twice a day for 7 days, and then stopped for 14 days to see what happened to their blood pressure. And this here was one example, kind of what we call the outlier. This is a 21-year-old dental student, and about 3 days after starting the chlorhexidine mouthwash, his blood pressure went up 26 millimeters of mercury. So we made a normal, 21-year-old, normal intensive, well-active, good diet, good oral health dental student, clinically hypertensive, just by giving mouthwash. And interestingly, we identified bacteria that disappeared when his blood pressure went up and identified bacteria that reappeared when his blood pressure normalized. The good news is 4 days after stopping the mouthwash, the oral microbiome repopulated and his blood pressure came back down. So this wasn't a chronic, non-reversible effect. And this was kind of the main slide of the paper we published, that we could predict steady-state blood pressure either before or after mouthwash use by the number and presence of these 4 bacteria. And so we obviously filed a number of patents on these. We think this is a diagnostic now. So people with resistant hypertension simply have an oral dysbiosis. They're resistant to standard medications because their hypertension is not due to a renin-angiotensin disruption or a disruption in calcium flux. So standard antihypertensive medications don't work in these patients. The source of the problem is an oral dysbiosis. Let me spend a little bit of time on diabetes because it's a worldwide epidemic. We've known for many, many years that once you get diabetes, diabetic patients don't make enough nitric oxide, and most people don't die of diabetes. They die from the vascular complications of diabetes. But interestingly, when you knock out the gene that makes nitric oxide in mice, their first phenotype is insulin-resistant type 2 diabetes. So this provided us with an interesting concept that perhaps it's the early loss of nitric oxide that causes insulin resistance, diabetes, and then diabetes further suppresses nitric oxide production. And that's why these patients are so poorly managed, because there's not an anti-diabetic drug that affects nitric oxide production. So we began to try to map this out and figure out if we could provide a solution to the problem. And this is a complicated slide, but this is basically the insulin signaling pathway. When insulin binds to an insulin receptor, it initiates a number of cell signaling pathways, PI3 AKT kinase, and even AMP kinase, which is the target of metformin. But both of these converge on the nitric oxide synthase enzyme. But we know in diabetics, this enzyme isn't functional, it's uncoupled, so it doesn't make nitric oxide. And then that was really where the literature led us astray, because there was nothing more on how GLUT4 translocates and takes up glucose and internalizes it. And so we basically figured this out. We published this in 2014, that you can, if you can post-translationally modify the cysteine residue on GLUT4, either by stimulating nitric oxide production or giving an exogenous NO donor, then that's necessary and sufficient for GLUT4 to translocate to the membrane, bind glucose, internalize it, and simply by restoring nitric oxide production, you can improve fasting glucose levels, fasting insulin levels, and overcome insulin-resistant type 2 diabetes. So that was a very profound discovery, and so the question is, well, how do we control and regulate nitric oxide production to give us targets to fix for not just diabetes, but for other chronic conditions? And I'm not going to go into the detail just because I don't have time, but there's 2 ways the body makes nitric oxide. One is through this enzyme nitric oxide synthase. The other is through diet, where you get nitrate primarily from green leafy vegetables that the bacteria reduce to nitrite, and then mammalian enzyme systems reduce this to nitric oxide. There are a number of products on the market, but I don't have time to go into the complex biochemistry, and it'd probably bore you to begin with. But these are the practical things that you should do. So I tell people all the time, if you're nitric oxide deficient, stop doing the things that disrupt normal nitric oxide production. And these are antiseptic mouthwash. You have to stop using mouthwash. It's bad. There's clear evidence now that it causes an increase in blood pressure. I was on the doctor show several months ago providing evidence that if you use mouthwash, you actually lose the cardiovascular benefits of exercise. You lose the cardiovascular benefits of exercise by using mouthwash. Now, people with chronic halitosis, severe oral infections, I think probably an acute regimen of an antiseptic may be beneficial, but this chronic mouthwash use that people are doing every day, waking up every morning, sometimes multiple times a day, is doing more harm than good. Antacids, proton pump inhibitors, very bad, dangerous drugs. FDA never approved them for chronic use, but yet people take them daily. And then stop eating high carbohydrates, highly processed junk food. That really feeds the bad bacteria. Once the bad bacteria start to overpopulate, it kills off the good bacteria. It's really a competition for resources in the oral cavity. So you got to feed the good and kind of starve off the bad. So once you stop doing those things that are disrupting normal nitric oxide production, then do the things that are clinically shown to promote nitric oxide production. Eat a lot of green leafy vegetables, moderate physical exercise. I like infrared light therapy, just getting out in the sunlight, infrared saunas. And then, we've made some discoveries where we've got products on the market that are patented and clinically proven to restore nitric oxide production in humans. So as we go through this, people are nitric oxide deficient for a number of reasons. As I mentioned, the standard American diet, we're not getting enough nitrate in our foods because we're not eating enough green leafy vegetables. If you're eating organic, you'll never get enough nitrate from those. Insufficient saliva production, people with Sjogren's syndrome or, cancer patients have undergone a prostatectomy. They have symptoms of insufficient nitric oxide production. Antiseptic mouthwash, bad news, poor oral hygiene. Again, the pathogens outcompete the good guys. It's really it's a diversity issue. You want a highly diverse oral microbiome, allow the good guys to do their job. It keeps the bad guys in check. And then you need stomach acid. Your body cannot and will not heal without stomach acid production. You have to stop using antacids. So when we set this out and realized how the body makes nitric oxide and read through this drug discovery program, we set some milestones of what we hope to achieve. Number one, if your body can't make nitric oxide for whatever reasons that I just mentioned, then we have to do it for you. But then understanding the enzymology and biochemistry to the extent that we can actually fix the reason your body can't make nitric oxide. We want a plant-based natural products chemistry. It's clean and testable, clinically proven and peer-reviewed placebo-controlled trials. And so I'll just take you through the clinical trials of the technology we developed back in 2010. All these clinical trials are published. The reference is at the bottom. And so this left panel here shows you that when you put this lozenge, which is an orally disintegrating tablet, in your mouth, it's activated by your saliva and it generates nitric oxide gas. We can quantify it, we can verify it. When the lozenge is dissolving, it's generating NO gas. So if your body can't make nitric oxide, the lozenge does it for you. And if we give this to people with an elevation in blood pressure, you can see within 20 minutes, their blood pressure begins to normalize. A statistically significant reduction in both systolic and diastolic blood pressure. 60 minutes later, there's a further reduction in both systolic and diastolic blood pressure. The placebo, there's no effect. So this told us we're releasing nitric oxide and it's bioactive because it's dilating resistance arteries and decreasing blood pressure. And then this panel here is really looking at endothelial function, or what we call flow-mediated dilatation, or the body's own ability to generate nitric oxide. So 4 hours after you take a single lozenge, we've improved the body's own ability to make nitric oxide by 20%. So we can check off those first two. If your body can't make nitric oxide, we do it for you. It's vasoactive, biologically active, normalizes blood pressure, but then we recouple the nitric oxide synthase enzyme and really fix endothelial dysfunction and the inability to generate sufficient nitric oxide. Here's some cool imaging we use. We use an ultrasound here. This is the left common carotid. This is the artery that goes up the side of the neck. You can see in this particular patient, you can get baseline internal luminal diameter of 0.52 centimeters. 10 minutes after the lozenge, you can see this carotid artery has dilated to 0.6 centimeters. So this 13% increase in blood vessel diameter causes a 34% increase in blood flow. If you go back to that SPECT scan, if you want to increase blood flow to regions of the brain, you've got to get it through the main conduit artery, which is the carotid. So we increased blood flow to the brain by 34% in 10 minutes. And it's not just isolated to the brain. You can direct it to the pelvic region for sexual function. You can direct it to the heart if you want to increase exercise capacity. Then this was a study published at Cedars-Sinai, taking pre-hypertensive patients and taking one lozenge twice a day. We were able to take, after 30 days, lower systolic blood pressure, 12 millimeters of mercury, diastolic blood pressure, 6 millimeters of mercury. We took on average patients with a blood pressure of 138/84 and in 30 days brought it down to 126/78. No change in heart rate. 6-minute walk test, those taking the active were able to walk significantly further, showing an improvement in the functional capacity of the heart. And then we also gave them a quality of life questionnaire, and those taking the active showed an improvement in both physical and mental composite scores. And those that were taking the placebo actually got worse. Other cool imagery, this is thermography, small vessel disease, a patient with Raynaud's, cold hands, cold feet, 10 minutes after the lozenge. You can open up the microcirculation, perfuse the digits. This was an interesting study by an endocrinologist in Orlando, excuse me, taking patients with stable carotid plaque for the previous 3 years and gave them our lozenge twice a day for 6 months, and we saw 11% plaque regression. If you look at the meta-analysis on statin therapy, statins regressed plaque 2.7% after 3 years, but getting cholesterol in the basement. We do this 11%, 6 months, no adverse events such as with statin therapy. And then let me just end with this. Probably the most gratifying thing I've done is collaborate with some physicians at Texas Children's Hospital. There's a group of patients that called an inborn error metabolism. They're born without an enzyme called arginine lyase. So this is a urea cycle disorder. For those of you familiar with biochemistry. And so without this enzyme, you get a buildup of arginosuccinic acid in your urine. These patients are called ASA patients, or arginosuccinic acid urea. But they develop a number of clinical symptoms. Their number one problem is hyperammonemia because of the urea cycle disorder. But even though you correct for the hyperammonemia with diet restriction and drug therapy, they still develop liver dysfunction and cirrhosis. A lot of times these kids will have to have liver transplants at 7 or 8 years of age in order to survive. They have blood clotting disorders. And they have neurological dysfunction independent of recurrent hyperammonemia, resistant hypertension, and kidney disease. And so the question was, is this more than a urea cycle disorder? When we published this in Nature Medicine in 2011, but we discovered a new protein complex that really adds a level of complexity to nitric oxide. So this enzyme, arginosuccinate lyase, is what tethers the nitric oxide synthase enzyme to the membrane. So in these patients that don't have this particular protein or enzyme, this complex falls apart and they can't make any nitric oxide. So this is the best human model there is of complete nitric oxide insufficiency. But in fact, it explains every single symptom they had that was previously undescribable by their clinicians. And so if you look at the lifelong blood pressure of this particular patient here, you can see at 5 years of age, he was diagnosed with this particular urea cycle disorder. He had blood pressures that were greater than the 90th percentile of a normal 5-year-old. And you can see over a period of 10 years, he was very poorly managed with standard pharmacotherapy. And in February of 2010, he presented to Texas Children's Hospital in the pediatric intensive care unit with a blood pressure of 185/110, a 15-year-old kid. At that time, we knew we had a pretty good indication it was a nitric oxide issue. They started dosing him with isosorbide, which is an organic nitrate that's metabolized into nitric oxide. 4 days later, he was released from the hospital. And he did quite well for a period of several months, but he developed tolerance to these drugs, which is standard with organic nitrate therapy. And in February of 2011, he came back to Texas Children's. His blood pressure was, I think, 185/110, or similar to what it was the year before. But he was taking 20 milligrams ISDN 4 times a day. We started dosing him with the nitric oxide lozenge. 4 hours later, his blood pressure completely normalized. And this was 2 months later. We published this in the American Journal of Human Genetics, I think in 2013 or 14. We're now 7 or 8 years out. The kid graduated high school. His cognition improved. He's off all prescription medication. His heart disease resolved within 5 months. This kid had a heart twice the size of a normal 15-year-old. 5 months later, he completely remodeled the heart. And when you restore nitric oxide production, stem cells begin to work. They mobilize and completely remodel the heart in 5 months. His kidney disease resolved in 3 weeks. So I'll take you very quickly through some cool FDA-cleared medical devices, non-invasive. This particular device here looks at pulse wave analysis. And what you want to see type 1 or type 2 blood vessels. That tells us that the blood vessel is soft and compliant, very little plaque in the lining of the blood vessel, where the type 4, type 5 blood vessels. There's stiff arteries, a lot of plaque. That's what you don't want to see. And so we began to collect data on these patients, and this is a 74-year-old female, had type 5 blood vessels, gave her the lozenge, one twice a day for 90 days, and converted these vessels into type 1. Again, another 70-year-old female in 60 days took type 4 to type 2. And we've got hundreds of these patients now. But people like to see this because you show them their blood vessels aren't healthy. You give them the nitric oxide. A couple months, 60, 90 days later, you bring them back and show them that their blood vessels actually improve. Next, let me switch to our latest little project here, because once you realize how to make nitric oxide, you can implement this in every market segment around the world. And that's what my objective is. And so there's topical nitric oxide. Now, we developed some technology because, in people that have, eczema, topical, small vessel disease where you need to enhance nitric oxide and circulation topically, we can now do that. And really, for me, aging is really poor circulation. So if cells of the dermis don't get the oxygen nutrients they need, or they don't take out the metabolites, then these cells fail. And when cells fail, you lose hydration, you lose collagen, your skin becomes sagging, you get wrinkles, and it's the outward signs of aging. If you improve nitric oxide production, improve circulation, you can prevent the signs of aging. And that's exactly what we've got here. So we've got a dual chamber nitric oxide delivery system. So you take one squirt from one side of the chamber, turn it around, take another squirt from that, you mix it together, apply it to the skin, the face, the neck, or décolleté. And these are the results you get. This is using it twice a day for 30 days. These age spots disappear. Here's a 54-year-old female with what we call a turkey neck. 30 days later, you can see the complexion and the wrinkles vastly improve. Again, the varicosity that comes with age. Wound healing, very effective. This is a full-thickness ulcer post-facelift. This lady began to smoke too soon after surgery, developed a full-thickness ulcer. Apply the nitric oxide serum on and around the wound, and 10 days later, you get complete closure. Acne, again, antimicrobial effects of the nitric oxide, improved immune function, basically very effective in clearing it back. This is a 13-year-old girl, used it for 3 days, you get almost complete resolution in very short order. And it doesn't matter the skin type, whether it's Caucasian, African-American, brown, Asian, nitric oxide is agnostic. It dilates blood vessels, improves circulation, no matter what the skin type or color. So let me just wrap up here to kind of give you some take-home, kind of some pearls, because this is confusing for even me, and I've been doing this for 20 years. If you go, and there's lots of products that, so-called nitric oxide products on the market. So how do you, number one, as healthcare practitioners, know which product works? And then patients, and they go to the GNC or the pharmacy, and there's 3 dozen products saying the exact same thing. So how do you know what to get? And there are a lot of products now that are using beetroot extract on it. So all beets aren't created equal. Beets do not equal nitrate. In fact, we use a lot of the commercial beet products off the shelf as our placebos in our clinical trials because they have no biological activity. The only thing they do is turn your pee and your poop pink and give you an awful taste. So beets do not work typically. Nitrate does not equal nitric oxide, so you can't. It's very difficult if you use a mouthwash or antacids, things like that. You cannot even get nitric oxide from the foods you're eating, or nitrate, potassium nitrate capsules. And then arginine citrulline products do not work in patients with endothelial dysfunction. In fact, the reason people become deficient in nitric oxide with age is that they've lost the ability to convert arginine to nitric oxide. So taking an arginine product as an older patient is like putting gas in a car with a blown-up engine. You're not out of fuel, you've lost the ability to convert it. So what do you look for? Look for patents on products. This demonstrates innovation and uniqueness. Look for published clinical trials. If you've got a nitric oxide product that works, you should be able to show clinically meaningful benefits. Clinical trials are expensive, they're very risky, especially for dietary supplement companies. Most companies are not going to go through the rigor and the expense of a clinical trial because their products do not work. Or is it licensed from a reputable university? And then is the inventor, a product developer, an expert in biochemistry? I've been invited to a number of webinars where you've got these so-called experts giving a webinar information on nitric oxide, and they've never published a single paper on nitric oxide. This is a very complicated, complex science. So my point is, don't be fooled by creative marketing. Science and experience matter. So I like that we're in this age of biohacking. I think we can use this, especially in COVID. People with nitric oxide deficiency, more increased risk of infection. Those patients rapidly progress to hospitalization. You take the lozenge twice in the morning. The serum is good to put underneath your nose, your hands, around your face, because nitric oxide actually kills the coronavirus. So I'll just conclude that hopefully I've convinced you nitric oxide controls and regulates vascular structure and function. There's an age-related decline in nitric oxide that asserts itself on cardiovascular risk and chronic disease. Restoring nitric oxide can lead to better vascular function, better perfusion of all tissues, which is what's needed for cells and tissues to operate efficiently. Strategies to restore no production. We're seeing it. We've been doing this for over 10 years now, having a profound impact on public health and on the aging process. And I'll just leave you with a couple of resources here. So I've got an educational website. It's there at the bottom, drnathansbryan.com. And I've got a 6-minute video on there that'll basically tell you everything I just told you in 6 minutes. So I could have spared you the time and just sent you the web link. But I think it's important, and I have a monthly blog there. I try to provide some logical and practical, up-to-date and timely information on nitric oxide. If you have any questions, there's my email. Feel free to email me. I'll always respond. Sometimes it may take me a couple of days to get through them all, but I'll always respond. And then those of you that are interested in learning more about this in a lay read, there's my latest book called Functional Nitric Oxide Nutrition. It's available on Amazon. And then the product offerings, there's some codes there if you're interested in utilizing some of the product technology that we developed over the years. This is a doctor's supplement store where you can get both all nitric oxide technologies for those of you that may be interested. But with that, I can't thank you enough for your time to spend with, give me an hour. Alan, thank you very much for the opportunity to hopefully educate and provide some meaningful information to not only dental health and practitioners, but really to anybody else that's listening, because I think we're at a time where we can't rely on other people to take care of us, and we can't rely on doctors always to take care of us. We have to get the information we need and take our health into our own hands. And hopefully this has been informative and educational. So again, thank you very much. And I think we'll open it up for some questions.
Yeah, wonderful, Dr. Bryan. Thank you so much. That was fascinating. Very, very, very informative. Very much appreciated. Well, yes, let's take a look if we have any questions that have come through. Sarah, do you have any?
I do. I've got one right here. Compared to the oral intake of nitrate/NO, how does nasal breathing's production of NO compare?
That is a great question. So there is evidence that, the same enzyme, the nitric oxide synthase enzyme that's in our endothelial cells is also in our airway epithelial cells. And so these are activated by mechanoreceptors. So when you breathe in deeply through the nose, it activates these mechanoreceptors that tells this enzyme to make nitric oxide. When young, healthy people where the enzyme is coupled, similar to beginning exercise, it tells this enzyme to make nitric oxide. But in older patients that are nitric oxide deficient, because the enzyme is dysfunctional, then the airway epithelial nos is dysfunctional as well. So the deep breathing does not work in these particular patients until you restore the function of that enzyme. And so that's what the technology we developed does. It helps decouple that nitric oxide synthase enzyme so that when you do deep breathing, you can get the nitric oxide produced. And that's been shown to lower blood pressure. There's a sympathetic, there's an autonomic response to that as well, but a lot of it can be described by the nitric oxide that's produced in the airway epithelium.
Great, thank you. I do have a couple more here. You had mentioned about the lozenges. Do you have to take those for life when you start taking them?
I tell people all the time, there's no need for medication or supplementation if you give your body what it needs. What I've learned over the 20 years is that people get sick for two reasons and two reasons only. number one, their body is exposed to something that it doesn't need, or number two, it's missing something that it needs. And many of the foods we eat today we don't have enough nutrients in them, like the chromium, magnesium, selenium, iodine. And so many times we have to supplement just because of the farming practices that the food become deficient in things. So in that case, you need to supplement. The other thing is there are a lot of things that we do, whether it's exposure to herbicides and pesticides on vegetables, that uncouple the nitric oxide synthase enzyme. We're finding now that EMF, from 5G and all these other frequencies are disrupting nitric oxide production. So when we go out into the world, we're exposed to these things that continually bombard our body and render some enzymes dysfunctional, such as nitric oxide synthase. So in a real world situation, no, because once we fix the body's natural processes, and then you do everything you do, provided you're getting all the nutrients you need, and you don't have any infections or toxins that are shutting down nitric oxide production, then no, once you restore that, then your body's designed to continue to do that. But in a real world environment, you need daily supplementation of many minerals and nutrients, and you need daily nitric oxide support, because it seems like everything we do or exposed to impacts our nitric oxide production.
Excellent. Dr. Bryan, another question. How can one test the level of nitric oxide in their system?
That's a very good question, and one we answered or tried to address over 10 years ago, because when we brought this nitric oxide product to market in 2010, we went to a lot of clinicians and patients, and they go, well, if my doctor told me I needed nitric oxide, I would take it. And then we went to doctors, and they go, well, how do we know our patients are deficient in nitric oxide? Because there's not a lab you can pull like for cholesterol or vitamin D or triglycerides. It's not a blood test. So I developed this salivary test strip. And so they're a nitric oxide indicator strip. You apply some saliva on the end of this test pad, and within a couple of seconds, it'll turn a bright pink, or we hope it turns a bright pink. And that tells us that your body has the capacity to generate nitric oxide. But if it doesn't turn pink, and then it tells us that your body is deficient in nitric oxide, but it doesn't tell us why. So then I tell people it's a good tool to have in your toolbox, but it shouldn't be the only tool you use. But it's a cool way to really measure your nitric oxide production capabilities. And then, if you're low, you can just try to include a few more vegetables in your dietary routine. Or if you're using mouthwash, stop and just see if that alone improves the reading on the test strip. And then it gives you a way to kind of monitor your levels. So that's really the only way biochemically to tell. But, as I mentioned earlier, there's these devices that you can use to measure endothelial function, which one is called the EndoPat and the other is a device called the Max Pulse. And those are FDA-cleared devices that many clinicians can use in their office. But really, that's the only way that we figured out how to determine it. Other than the symptoms, if you have high blood pressure, chances are 95% chance you're not making enough nitric oxide. If you have erectile dysfunction, that's a condition of nitric oxide insufficiency. If you've got mild cognitive disorders, even vascular dementia, that's a nitric oxide problem. If you have diabetes, that is a nitric oxide problem.
Excellent. Thank you. Thank you. Any other questions that you've gotten coming in, Sarah?
Yeah, I've got one more here from one of our attendees. How to help patients tolerate the enologins if it causes gingival irritation? So,
well, people that have, yeah, that's a good question. We have heard that previously from some dental professionals. So nitric oxide is antimicrobial. And so it'll actually kill off bacteria. The other thing we're finding is that people that have a lot of fungal infections and thrush and things growing in the mouth, there's a lot of people that are using mouthwash, but they're killing off all the good bacteria that keeps, a lot of fungus and molds and things like that from growing in the mouth. So what we're finding is the sensitivity comes mainly on the tongue is what we're hearing. And so usually we're finding that's an acidic oral cavity. It's causing the irritation, which tells me they've got some oral issues. Maybe it's an infected root canal or some other infection, periodontal disease or gingivitis that's gone, untreated. So we tell the people if there's irritation from the lozenge, take some baking soda, sodium bicarb, and swish it for 60 seconds to alkalize the oral cavity, and then that seems to make the irritation from the lozenge go away.
Excellent. Good, Sarah. Any others?
Okay, so I do have one. It's more of a personal question. I had a big birthday this year, and I've noticed that under my eyes, I'm getting a lot of kind of like red blemishes these days. Oh, I can't believe I'm admitting this in front of everybody. But I was wondering if your serum could possibly help me.
Well, we've got 4 published clinical trials now from looking at the clinical benefits of the lozenge. And, those are published clinical studies, but to answer your question, based on the published clinical data, is yes, we see a great improvement in signs of anti-aging, in acne, scar remediation, and all of those. And so I'm happy to provide those. If anybody's interested in seeing the reprints of those clinical trials, I'll be happy to send those through email.
Wonderful. Wonderful. Thank you. Thank you so much for sharing all of this great information, with us, Dr. Bryan. It's very, very much appreciated.